I will be discussing the misdiagnoses of adolescent ADHD. So the main problem is that misdiagnoses of ADHD in children leads to overuse and unnecessary use of ADHD medications in this population. There's no specific marker for a diagnosis, since a diagnosis is based off of persistent patterns of inattention and/or hyperactivity that interferes with the functioning or the development of a child. This diagnosis seems very subjective. For example, the criteria of talks excessively could differ from child to child. Lastly, the overuse of ADHD medications have long-term side effects that are unknown in children this early in development. Also, the cost of prescriptions for these drugs could be prevented if a child does not actually have the diagnosis. A potential solution for this is an innovation called Lemur DX from the PIT Innovation Challenge. This is a smartwatch app to track children's activity levels based on context, for example, reading versus playing, to accurately determine an ADHD diagnosis. So you can see an example of the interface of the app on the left, and on the right you can see the activity levels based on context, for example, playing versus reading in child A and child B. So what makes this innovative? This app differs from what is currently on the market in that it measures activity levels based on context, while current watches only measure activity levels in general. It also collects data for up to 1 week and then transfers data to a secure server, which has algorithms to differentiate hyperactive versus combined ADHD from typical activity levels. This chart shows how the app differs from questionnaires, which are frequently used to diagnose, and how it differs from current watches. An example of a user persona for this innovation would be Adam, an 8-year-old boy who struggles to focus in school, is easily distracted, and has trouble waiting his turn, as noted by his parents. Adam frequently uses computers and iPads, so he would be comfortable wearing a smartwatch, and he would also be physically able and willing to wear the smartwatch. He cannot swallow pills, so he wouldn't be able to take capsules such as the stimulants he would be prescribed with a diagnosis. In general, his parents are skeptical about medications and prefer natural remedies, and multiple of his classmates with similar mannerisms have recently been clinically diagnosed with ADHD, which has prompted Adam's parents to inquire about a possible ADHD diagnosis in their son. So a prototype of this app could be tested by digital prototyping, since the app is already made. And digital prototyping could show how the app reads and records the activity levels, and could also show the user interface of the app to show its ease of navigation. This prototype could be implemented by selecting a population of children, for example, ages 7 to 12 at a specific pediatrician's office, who show signs or complaints of ADHD symptoms. And this should be done in a pediatrician's office with a high prevalence of ADHD medication prescribing. Then, if the patient and their family agree to partake, the child would then wear the smartwatch for the given period of time. In order to differentiate the innovators versus early majority, innovators would be those who are excited about new tools to diagnose ADHD, or those who would want a second opinion prior to an official diagnosis, since a current diagnosis relies mainly on a questionnaire. The early majority would be children of parents who are skeptical about their child starting a stimulant and who would want to try different or new diagnostic tools, but who are also skeptical about how a watch could diagnose. And it would be those who require time to really warm up to the idea of a watch being able to diagnose ADHD.